you are tuned in to TT Online Community Voices, a project of the Ministry of Sport and Community Development, where we seek to inform, educate, and even challenge persons concerning the issues of health, wellness, well-being in various communities. And so today's program will be focusing on lupus. We trust that you'll be able to tell a friend of the information that you've received and be able to spread this word as we go forward. Today on the set, we have a number of persons from different positions in society, so to speak, but we're trusting that we'll be able to get a good perspective of this area called lupus. What do you know about lupus? Can anyone be diagnosed with it? And therefore, how do we treat it moving forward? I want to introduce the first speaker today, who is Ms. Donna Gulston, and she is the Acting Director of the Health Education Division. Welcome to the set, Ms. Gulston.
Thank you so much.
So tell me concerning this issue of lupus. So some literature here provided for my friends. It says lupus is a chronic disease characterized by inflammation in one or more parts of the body. It belongs to the family of autoimmune diseases, which include rheumatoid arthritis, multiple sclerosis, juvenile diabetes, scleroderma, and so on. Could you give some insight from that perspective of this whole issue of lupus?
While the Ministry of Health, through its various arms, which includes the RHAs, makes access available to persons in the health sector so that we can go, if we suspect that we have one of these diseases, to get confirmation. It may not be an easy process simply because the signs and symptoms may vary and they may be akin to other signs and symptoms. But there's access. We can go to the health facilities and we can go to our private physicians if we suspect that we have one of these diseases or if we are concerned, and we can also get assistance there. Additionally, through the vertical arms of the Ministry of Health, which include the Health Education Division, we work with communities and NGOs, such as the one represented here today, the Voice of Lupus. We work with them to educate the community so that persons can be aware if they feel a certain way or they suspect that they might have this disease, what should I do? How can I connect with other persons? How can I get support? So this is where the Ministry of Health works in collaboration with NGOs in order to support persons in the communities.
Okay, all right, so probably I can turn this question to Dr. Bovell, sorry. With respect to the signs and symptoms of lupus and this autoimmune disease and so, could you share some information, please?
Well, first of all, thank you for inviting me to this discussion. I work in rheumatology, which is autoimmune diseases, a clinic in St. James. So all of my patients have one form of autoimmune disease or the other.
Wow.
And a lot of the times, both the patient and their families or friends don't understand the disease. So they suffer in silence. And I'm glad to be able to share some knowledge, not only to patients, but to those around so that they can be more empathetic with those who suffer with the disease. And today we focus on lupus. So with lupus is one of the autoimmune conditions that we see quite frequently in Trinidad. It's more prevalent in the female Afro-Caribbean population, and there are a wide range of symptoms and signs and presentations that patients can present. Some of the most frequent are hair loss, a rash, it's called a malar rash, from the nose to the cheeks, sparing the nasolabial folds. They complain of fatigue, tiredness, joint pains. They may have ulcers in their mouths or other areas. They may have chest pains, shortness of breath, which usually is due to like swelling around the surfaces of their heart. Sometimes they have psychiatric manifestations, depression, anxiety, psychosis. Sometimes it could just be an investigation that was done and their white blood count or their platelets are low, and nobody could really figure out why this is low. And when we start to ask the patients a little closer, have you been experiencing this? Do you have this? Then we start to realize this may be an autoimmune condition and this may be lupus. So those are some of the signs and symptoms.
So as you mentioned, in terms of those areas, you would advise someone to start paying attention even more to themselves, because sometimes we can dismiss these signs and symptoms, and so people would treat it with some bush tea or some topical medicine or the case may be. But what you're saying is something deeper than that you need to pay attention to.
Well, before I worked in rheumatology, I worked in the local health centers, and I would just encourage patients on the whole to be more vigilant of their bodies and themselves. And that if something was happening for more than 6 weeks, don't ignore it. Start to say, why? Am I doing something differently? And if it's beyond your scope, not being a practitioner, you go to your first care. You go to either your community doctor in the local health center, or you go to your private practitioner, whichever you prefer. And you start to say, listen, I've been experiencing this, and I always say, safety, better than anything else. Yeah. If it's something just simple and the doctor says nothing to worry about, well, then you know you have a sense of peace after that, because you know you've cleared the more sinister possibilities. So as far as lupus is concerned, I would always tell my patients, don't drag on the symptoms. Call us, even if you don't have an appointment, call us and say, doctor, I'm experiencing this, so that we're able to deal with it a lot quicker. And most of the time when you deal with a situation quicker, you prevent more serious sequelae. So yes, be vigilant, be aware of your body, of changes, of just generally not feeling well, and seek medical attention. It's always a better option.
Much appreciated. And some people would hear that advice, but because of the fear to be diagnosed in terms of with lupus or some condition, they might prefer to stay away. What would be your thoughts towards those persons?
Well, I always tell patients that early diagnosis usually allows patients to get into a state of remission, and in some of the diseases, cure. So fear does not help. If you are afraid, talk to someone who can accompany you to the clinic, come with you, walk you through that journey of tremor, and just get over the first hurdle, and you'll realize that when you do come, there's a support system in place for you. There are the nurses and the doctors who are accustomed dealing with patients of this sort. And everyone there, patients as well, may be suffering with the same thing as you. So they can offer you advice, they can give you some coping skills. And most of the time, it may not even be lupus. We may alleviate your fears and tell you this is not lupus. This may be that you may have a mineral deficiency, you may have, your thyroid may not be functioning well. It may be another cause that's masking these symptoms, because the symptoms of autoimmune are so vast and wide that many things can give you the same symptoms. So don't allow fear to make you suppress, seeking help. Stand forward, be bold, and take charge of your health. And as I said before, if you need someone to come with you, no problem, bring someone. We welcome support.
Thank you very much, Dr. Charisse Bovell of the Physical Medicine and Rehabilitation in St. James. And she mentioned the concept of seeking help and getting support. And I want to direct our attention to our next speaker, who is going to share on the Voice of Lupus Foundation. And for some of us may be familiar with her, she seems to be the voice of the Lupus Foundation. And I've taken the opportunity to be donned with a mask with the color of the supporting initiative of the Lupus Foundation. So it's my privilege to hear from Ms. Reanna Harrilal, who's the president of the Voice of Lupus Foundation. Welcome to our set, Ms. Harrilal.
Thank you for having me. Good afternoon.
So we're speaking about lupus from the experiential standpoint. We've heard in terms of the medical and the operations, in terms of the structure and the system and the health fraternity.
Yes.
But let's drill down now to that experience. Could you share with us?
Sure.
Can anyone get lupus? Is it limited to certain persons? Also?
Yes, there is a genetic predisposition, but yes. But one of the things that we must understand too is that lupus is a respect of no person. So, I mean, it's known as a woman's disease, but men also get lupus. We have children getting lupus. We have young children as early as 3 and 4, suffering from organ failure, renal failure, stuff like that. The Voice of Lupus Foundation was birthed back in 2011. I am a lupus warrior. I refuse to say I'm a sufferer. Mm-hmm. I'm a warrior. Every day I get up and I fight, to survive. I fight to live, but I also fight with a purpose to build advocacy in this country. Because when I was diagnosed, there was no avenue available for assistance. And when I started this organization, it really was to build that capacity, to educate the public, and also to provide support for those who have been given what seems to be a death sentence. Because lupus has no cure. I must add there are 4 types. There's discoid lupus, which affects just the skin. There is systemic lupus, where all the organs are involved. There's something called drug-induced lupus, and then there is neonatal lupus. We have so many cases of systemic lupus where major organs are involved. Many of them are on the verge of kidney failure. Many persons suffer with chronic pain. I limp because I have some really bad pains in my hip, but what I appreciate about this initiative is really getting down into understanding, even though my illness seems invisible and the symptoms of my disease are invisible, I am not. Right. And many people who are suffering with lupus, they don't look sick. But how can you justify just because I don't look sick means that I'm not?
Correct.
And I'm not faking. And oftentimes, a lot of patients call us and they say, they're having trouble with their employers. People don't believe that they're ill because they don't physically sometimes look ill. And that's the task. And lupus is known as a cruel mystery because guess what? It takes approximately 6 years to get a confirmed diagnosis from the onslaught of first showing the symptom of lupus. Now, what are some of the symptoms? Dr. Bovell touched on hair loss. You may have rashes, but then there are those where simple thing like headaches. You may have, blurred vision. You may just be chronically tired all the time, fatigue. I can't explain why you have a running fever. And the criteria for testing, it's not just you. Okay, so you have chronic fatigue and you're tired all the time, or you broke out in a little rash. Mm-hmm. You must meet 4 out of 11 criterias to begin the testing, and I think that in itself is a challenge because lupus mimics so many other diseases out there. So getting to the bottom of whether it's lupus or not, that is where most of the time is, because you're always ruling out, okay, it's not this, it's not that, it's not the other. And by the time you reach the official diagnosis, major organs are involved. So I'm telling you, 6 years is a long time.
It is, yes.
To be in that limbo, okay, do I have lupus or do I not have lupus, So one of the things that the organization is really passionate about is really providing the counseling and the support for patients. Many patients are unable to get the support from family and friends because most of the time you are listed as you're just lazy. People just think you're lazy, you're making excuses.
Interesting.
Yeah, I mean, it's really tough, and I'm grateful that, the organization, we're approaching our 10th year. We have made significant strides in bringing support to over 1,000+ patients in this country.
That is very good, very good. So dealing with the challenges, and then I'm glad you mentioned the time span in terms of proper diagnosis, and that's what we want to speak to. Do you find that there are persons who, as the saying goes, would have dropped off the system because it takes so long to diagnose?
Yes, I think some of them because of the frustration behind, even with the doctors sometimes. You know, what we have found is that some of the younger doctors now coming up in the profession, they are not trained to spot and identify some of these symptoms as that of maybe an autoimmune disease or even lupus. You know, so sometimes because I have cases where patients would call crying. They've gone to the hospital, but they're being told it's in their head. Nothing's wrong with them because sometimes it's very tough to get the symptoms to be on paper, so to speak, in terms of the blood work. I'm sure Dr. Bovell may have experienced some cases where the blood work is fine, but they're showing and they're meeting all the characteristics of lupus, but the blood work is not there to confirm the diagnosis. You know, so sometimes that has happened, and that's really a miserable life to live, because you know you're sick within yourself. You know, listen, I'm tired all the time. You know, I can't do this. I go out in the sun, I feel like I'm being drained. You know, I'm breaking out, I can't seem to function. And you're going by a doctor, and the doctor says, no, I think you just probably need to rest more, or it's in your head. I think you need to go out more. I had a doctor tell me I need to get married.
Okay.
I need a husband, you know, when I was a lot younger. You know, so I think education, this is a brilliant initiative. Education is the key. Advocating is the key. The more we talk about it, the more people understand, because how can you sit here and say you don't have lupus if you don't even know what it is?
Right. Correct.
And that's the whole thing. Understanding. Do you know that a lot of people think lupus is the disease in the Bible called leprosy? Do you know up to now people think lupus is a type of cancer? They think it's a blood disease. They think that, you know, it's linked to HIV and AIDS because it's autoimmune. The difference is with lupus, your immune system is overactive. With HIV and AIDS, what happens? It's suppressed.
Right. Okay.
You know, so that is the misconception we have to deal with as someone living with lupus all the time. But you don't look sick.
Right.
You know,
okay.
So it's been tough. Even going through, I mean, I'm not ashamed to tell you my story in a little nutshell.
Mm-hmm.
When I was first diagnosed with lupus, I was a broadcast journalist. I struggled to prove that I was legitimately ill. And then I had to be placed on disability. When I walked in to get through to disability, people looked at me and said, but why are you here? You don't look sick. And that's the misconception. Not because I don't have to use the cane or I don't have to be on a wheelchair.
Right.
That doesn't mean I don't have a legitimate disability.
Correct.
You know?
Okay.
So we're hoping to change that through conversation and dialogue like this.
Much appreciated. And so we can turn attention to Wendy Francis now, who is a member of the Voice of Lupus Foundation. And it's my understanding, Wendy, that you also dealing with lupus. Is that correct? Good. So, Wendy, share of your experience in dealing with lupus.
Okay, well, as Reanna rightfully said earlier on, it takes years to be diagnosed. So my symptoms generally started getting up in the mornings and my ankle was swollen. And I made several trips to the doctors and they would tell me, well, you know, you sprained your ankle. And I would say, but doctor, I went to sleep and I got up. So that went on for some time. Then I started having some heart palpitations. And when I went and I did all those tests, it revealed that there was something wrong with the blood. So they sent me further to do further testing. And it so happened around that time that I started experiencing the weight loss. The hair started to drop off. I started getting fever. My lymph nodes started swelling. And so they did several biopsies, several tests. And that is when it came back as most likely lupus. So that is how my journey started. Right? I was officially diagnosed in 2013. So I've been going through several years of changing symptoms. So as Reanna said, and as Dr. Bovell said, the symptoms have changed over the years. So it has started affecting the different organs, my heart. Most lately, it has started affecting the kidneys. right? I've had these severe joint pains, not being able to get off the beds in my bed in the mornings. So as you know, you get control over one symptom, another manifests itself.
Okay.
So you're in a constant state of imbalance. You don't know what is coming next. You try to deal with one symptom, and then another one comes up. And of course, there are the complex medications that we are put on. Because with the lupus, the immune system is overactive. So then the medication is supposed to suppress the immune system. But of course, the medications also have several side effects. So as much as we are dealing with one issue, the medications create other issues as well.
Oh, okay.
So it means that you're in a constant battle to deal with one symptom. Then you have the outgrowth of the medications with more symptoms, and then there is more medications. And it's a constant testing.
Yes.
I am at a stage every 3 months. I need to go and do blood works.
Okay.
I have to monitor myself constantly. And as Dr. Bovell said, I am part of the clinic there, but I also go private as well. I am lucky, and I put in quotes. I am lucky because I am working. So I can sometimes afford to go private, but it's still very taxing. It's still to see the various specialists. So I'm seeing nephrologist, I'm seeing cardiologist. Medication has damaged my eyes already. I'm seeing rheumatologists, and all the ologists that you could think about, they become part of the process, right? In terms of seeking medical attention from the public institution, the issue that I have and that many other patients have, sourcing medications within the time frame that we need to. Most times we are given 1 month supply. And if you go to the health center and it doesn't have any, then you are sent to go looking at other health centers.
Right.
So you're a lupus patient, you are ill, you're in pain. Some persons might be in wheelchairs, some persons might be with canes, and you have to go looking elsewhere. And then when you get to another center, they may give you 1 week supply or 2 weeks supply. And then you have to go back again. Right? So I consider myself lucky because I can supplement with private, even though it's very taxing as well. But there are many patients within the Voice of Lupus Foundation who may not be lucky. Many are out of a job. Many are on disability. Some are not. So they have to rely wholly and solely on the public medical institutions.
So I appreciate your submission. Is it possible then that with if to use the expression, the evolution or the changes that you experience from one situation to another, that some persons can be accused of faking, to use such a term, because, okay, 1 minute is this, next minute is that, and you're reporting something to your seniors, whether it be in terms of the office or even your family members, and they are now hearing a different report in terms of different weeks or so. Has that been experience of persons with lupus?
It has been an experience with several persons. What I generally get, but you don't look sick, you look fine. And I said, yes, just because I may be sick on the inside, it doesn't mean I have to project it on the outside. Because again, it goes back to mental health as well. If I'm feeling a certain way and I project it a certain way, my spirit is down for the entire day.
Right.
And then, of course, that is adding more stress. And that, again, affects the lupus. So many persons will say, but you don't look sick. I say, but you don't know what is happening. You don't know my heart is giving problems. You don't know my kidneys are malfunctioning. Right? So I have heard stories of persons who have been told that nothing is wrong with you. It's all in your head. And I think this is why it is so important with this forum here today, as well as through the Voice of Lupus Foundation, to bring the awareness so persons are aware. It is not just about how we look. It's about what else is happening. So when they get that particular information and they say, okay, it can affect your heart, it can affect your lungs, it can affect your brains because it affects the nervous system as well, then they are better able to understand and maybe sympathize with what you are going through.
Much appreciated. And so, Voices of Lupus Foundation acting as not only in terms of awareness, but as a support mechanism. Could you share on that concerning the support that's available to persons?
Sure. So back in 2017, I fell really ill. I was in a coma for approximately 21 days and was in ICU life support for 9 weeks. Luckily, I was abroad and I was able to, bounce back. And I'm grateful because I really thought that was it. I mean, I'm laughing here, but I have to laugh because, I looked at it as having two choices. I can sit in a corner, feel sorry for myself, or I can use I could use what this life has given me in terms of this battle, this journey that I'm on dealing with my health as a call to action. And I choose to look at it as that, to be able to empower others, to promote self-advocacy, because we are one of the biggest champions of teaching patients how to be their own advocate. Because let me tell you something, it's not easy living with a painful condition like lupus. There are days, Wendy and I can tell you, there are days we cannot even come off the bed. There are days the simple task of just holding your toothbrush to brush your teeth is a pain. Brushing your hair, even driving, walking, these things are things that you take for granted.
Right.
And I choose to live my life with purpose. With the Voice of Lupus Foundation, the support that we provide, it ranges from providing as simple as meals for patients, providing them with foodstuff, providing them with medications, because there are two main drugs that there's a challenge in the health system, the public health system to get. Salsa and hydroxychloroquine.
Did you say soursop?
Oh, I did not say soursop, okay. I said Celsap.
Okay.
Celsap is a drug that is used to treat organ transplant patients as well as those showing something called lupus nephritis, which is where the kidneys are being affected. Lupus is affecting the kidneys, and it's used to help. And that medication is very expensive. Lupus is a very expensive disease, and if you are unable to get it in the hospital, and if you're not working, and you are living off public assistance or disability. I lived off public assistance for over 9 years until I was able to get disability, because at the time I was getting NIS from the invalidity grant from NIS and what have you. It has been a real struggle. And many patients who aren't able to hold down a job, they have lost their career because of this diagnosis. They have to struggle, and sometimes we have to turn them away because not all the time we have the funding to provide for their basic needs of their food and medications. So apart from that, we do a number of webinar series to educate patients about their illness. Because when you're diagnosed with lupus, first of all, sometimes that's the first time you're hearing the word lupus. And many patients don't even know what their illness is. Right. So that's what we focus on, teaching them how to cope with their diagnosis, literally holding their hands through their diagnosis, and helping them with that support group, because we call ourselves a little family. It's 400 plus patients in that group of ours on Facebook, and it's a very intimate group because we rely on each other. Each one teach one, each one help one. But that's what we have to do. We have to rely on each other for that support, and it's a community of warriors. And I'm just encouraging persons to support the organization, support, and also if you know someone with lupus, we don't want sympathy, but we want understanding. We want empathy, understand what we're dealing with every day. It's a struggle. Sometimes it's a real struggle. I mean, I would take this mask off and show you that I don't physically look sick. I don't physically look sick, but then there are days I can't wear this bright smile of mine. There are days I can't. I struggle, and I am sure that there are many persons looking on who can relate, who have lupus. There are days when you can't even get off the bed. Wow. There are days when your body, you feel, I can explain it like this. Fatigue for us, it's like, okay, think of getting off the bed and you have 400-pound concrete block attached to both legs.
Wow.
That's the feeling, because you just can't seem to move. You just don't have the energy to get going.
Right.
And that's how it is sometimes.
So could you share probably contact information so
Sure.
interested persons
So
can
for
come up?
persons, yeah. So I was telling you about it in 2017. So after I got really ill and stuff, I came back to Trinidad, donated my home to the organization, converted it into the Lupus Learning Resource Center, because we had no way of paying a rent. It was so expensive, and I lived alone at the time and had my home, so I just donated it to the organization. So now persons have a physical place where they can come for help. So if you have been diagnosed with lupus, feel free to contact the Voice of Lupus Foundation at our Lupus Learning Lines number at 327-0220. And if you need to physically come to the office, we're located in Pleasantville, San Fernando. The Lupus Learning Resource Center, we're opened, and our doors will always be open to you. You're not alone. I just want you to know that you are not alone. We are here for you. And remember, there is us in lupus.
There's us in lupus, indeed, very significant, and of course, a fact. The whole issue of having that support mechanism, having someone to call on, as it were, that you're not alone going through, and even in the journey towards the full diagnosis, persons to walk you through the daily experiences with that sense of understanding.
Very much so, because when I was diagnosed with lupus, there was no help, and I really thought that I was all alone. And, you know, I went through so much, especially with my mental health, and I attempted suicide, and, you know, just went through so much with my mental, emotional health, understanding, trying to cope, trying to understand. Because it's like, you know, every day is something new with your body. Right, Wendy?
Correct.
It's like something new all the time. And, you know, just trying to figure it, because it's your body attacking your own self. You know, your body is your enemy. You are your enemy. Your immune system is wreaking havoc. I call lupus is the uninvited guest at a dinner party. It's the shadowy figure lurking behind your shoulder until one day it stands into the light for all to see. So some days I'm fine. Some days Wendy can run a marathon. And then there's some days we call on each other and say, oh God, girl, today's a really rough day. It's a bad day. And it's okay to have bad days,
Right.
but you're not alone.
Great.
You're not alone. And I think that's the biggest message. You're not alone. Whether you're diagnosed with lupus or anything, you're dealing with anything in life, you are not alone.
Right. So navigating the ups and downs,
Yes.
emotionally, psychologically,
Yes.
and so on. I want to direct my attention again to Dr. Bovell, this whole issue of the navigating the ups and downs, psychological, emotional, and so on. How has the experience been like for you in dealing with persons with lupus and so on?
You mean my mental health or the patient's mental health?
Both, in terms of, because even as someone dealing with someone with lupus, that impacts on them. So you can share that perspective from the two angles, as it were.
Well, I think in Trinidad and Tobago, mental health, there's still some stigma around it. So patients come into us, and sometimes we have to pull out of them, whether they're having low moments, whether more days than less are sad. If they are struggling with their disease, we usually have to poke and prod before there's admitting, yes, I'm struggling, I'm not feeling happy, I feel sad, it's hard for me to deal with. And really and truly, the majority of patients suffer psychologically from the impact of the disease, from just the pain from the disease itself, and then the limitations that they face on, as Reanna said, just some days they're not able to fulfill the usual tasks at home that they need to do. Within the system, we do have support services, we have social workers, we have psychologists, as well as psychiatrists if we feel the patients need some medication to support their mood. And we try as best as we can to pay close attention to their mental health, because that in general impacts greatly on their overall wellness.
Right.
A patient who is sad, it's not really going to heal as well as someone who is positive and happy. And this is to lay no blame on the patient that they're sad because of their personality or choice. Sometimes this is the impact of the disease. As physicians, it's hard to see young women struggling. You compare your own life, and sometimes patients sit and look at you and think, well, oh, you have no problems. Sometimes they don't know that autoimmune disease is right within your own home and your family. My sister suffers with an autoimmune disease, and she had the same experience of, for years, not knowing what was wrong with her, and she was away. She was not in Trinidad. And when I brought her to Trinidad, my boss at the time, Dr. Poon King, he was able to diagnose her like that. So I also want patients to know in this country that we do have very good physicians, and we do have trained specialists, and we do have the best here, as well as the voice of Lupus speaking about the challenges with medication. We are very fortunate in Trinidad because those medications are very expensive. And I have patients who, they snowbird, they live in the States and they come home. And they can't get those medications up there unless they have insurance. So we are still very privileged to have these medications free of charge. Every system, there's room for improvement.
Yeah.
So I agree fully with what she's saying. We always have to strive to be better and best. But we are still very blessed, and we still have a very good system for patients here who suffer with autoimmune conditions. And I want to just welcome anyone who thinks that they may have an autoimmune condition or suffer from something of this sort, not to feel that the system is inadequate. We have what you need to help you. And if we don't, we'll let you know and refer you to the respective places. Coming back to the original question as far as mental health of doctors who deal with patients who have chronic and debilitating diseases, it certainly takes a toll on you. No one likes seeing suffering every day. I know she says she's a warrior, but sometimes you see patients suffering, and sometimes what you can give is not enough. So you go home with it. It weighs down on you. You read, you try to figure out new ways that can help. And I guess this is our role. Our role is to walk with the patient side by side and hope that we can make living with this disease a better course.
Much appreciated. So in so doing, we have a perspective in terms of the medical standpoint, as well as the experiential standpoint, and we have reached the point where we can appreciate that we are all partners together in going forward. When we consider the issue of the medicine as in terms of a balance, treating and with the side effects, and so I'm sure Dr. Bovell, you would want to speak in terms of, yes, you have the side effects, but you still need it. And so I'm sure Wendy would want to appreciate that you got to function, and therefore it is necessary to take even with the side effects. And so what we're saying in terms of as a society, we can work hand in hand moving forward, and we need to have an appreciation. And it's good to know coming on from today that even from the medical practitioners and so, we can see a need to lend support to each other in going forward. Well, you have been watching an online program, and we are saying to you that be informed, be educated, as we seek to transform our operations as a society. This project will continue in terms of being able to sensitize persons from a deeper standpoint, from the, if we may call it, the academic as well as the practitioner in going forward. And it's our privilege at the Ministry of Sport and Community Development to present this series to you so that you can be informed, aware, and empowered. We thank you for your time. We look forward for you joining with us at another occasion.